Hello again, this is Dr. Shalona McFarland in the Philippines, and today I am going to talk to you about the nervous system. So this picture here depicts the autonomic nervous system. We sometimes call it the automatic nervous system because it's all the stuff you don't have to think about, like breathing and where your blood cells go and heart beating and all of that kind of stuff. It's the automatic stuff that we don't have to think about, okay? Now, as chiropractors, this is what we study right here, okay? The spine, the body, and all of its parts. Now, obviously, you can see that in different areas of the spine, it controls different things, okay? So the upper segments of the spine here control the eyes, ears, nose, throat, thyroid, all of these kind of things. So this is where your body only has 3 ways of telling you something's wrong. That's pain, discomfort, or dysfunction. And so some of those symptoms might look like a headache, vertigo, TMJ, ringing in the ears, tinnitus, okay? So all of that comes from right here, the upper cervicals. And so when you're out of alignment in through here, the symptoms are going to show up over here, the headaches, the TMJ, all that kind of stuff, okay? So as we move down the thoracic into the thoracic spine, you can see this controls the heart and the lungs. And so symptoms when this area is out of alignment, especially if it's been out of alignment chronically, are going to be heart palpitations, asthma, shortness of breath, anxiety. A heart attack can even be a symptom. If it's been a very, very long chronic subluxation, a heart attack can be a symptom of it, okay? All right, so then in this area here, the mid-thoracics, that's going to control the internal organs. So stomach in particular is going to be right below the shoulder blades. If you're out there, you're going to have issues of acid reflux, indigestion, GERD, things like that, difficulty digesting things. You can also have liver problems, kidney, spleen, intestines. So all of that comes from this lower thoracic region. And then as you get down into the lumbar spine, you're going to see issues with the bowel, the bladder, the sex organs, and that's going to look like constipation, diarrhea, UTIs, dysmenorrhea, prostatitis or ED in men, difficulty in getting pregnant or staying pregnant. Okay, those are all symptoms that something down here is not communicating well over here. And again, that doesn't mean you have a drug or surgery deficiency. That just means something's not communicating well. And so as a chiropractor, that's what I do, is I help give the body back the ability to communicate. So hopefully that answers some of your questions about the nervous system and sort of how it works. Obviously, these areas are also controlling the upper body, the arms, hand numbness, tingling, elbow tendonitis. The lumbar region will control the lower legs, the knees, the feet, plantar fasciitis, knee pains, hip pains, tendonitis, all that kind of stuff, okay? So it's not just the internal organs. It's not just the spine. It's the whole body. It can all be corrected. It can all be adjusted safely and effectively. Alrighty, guys. Hope that helps somebody out there with some questions. God bless. Talk to you later.